Now, our governor is more passionate about health, and that is what we should all be passionate about it, because we cannot continue giving services to our people, irrespective of any department, when people are not healthy. So we really love you, and we really encourage you in whatever you are doing. And I promise you that we are together with you, the ministry, all the stakeholders. We shall be working together to make sure that Nakuru is actually, we are striving to be number one in provision of health, good health to our people. Now, what is very important, I'm encouraged by our CHPs for the work they are doing. Pongezi sana. Pongezi sana. Thank you so much. You are really doing beyond your resources. We know that. And God willing, the day we shall announce something, you will also be the most happiest people in our county. So I don't want to preempt, because I know our High Excellency will be announcing that one very soon. But I tell you, good things are coming for you. And I know, as I was watching what was going on here, something came to my mind that we may go outside there. I was imagining one of the methods which was said here for men. I was taking myself to that room where the activity is done. And then I even asked Dr. Bashir, do you know of anybody here who has gone through? But if I can be given more explanation, you know what is very important is communication. So if I can be explained thoroughly whether all other things will be okay, I think I wouldn't mind. Why are you laughing? I wouldn't mind. No, it reminds me of a day when one of our seniors administrators was cautioning us that we must information so that people can understand what you are saying. Then he told us he was walking somewhere in a remote area, far away, a place which is very hot. And he was trying to advise the people. That was the earliest time when the HIV was spreading. And then he told the people, you know, in that place, you cannot wear clothes because it is very hot and people just walk even without clothes. And then he told the people, there is a dangerous disease which is spreading. So people, whenever you are moving, wherever you are going around, if you want to interact with people, make sure that you put on the condom. And then one day, while the administrator was talking, he saw some queer things people were wearing. And then he asked them, what are you putting on now? What is it that you are having now? Remember, they don't have clothes, right? So remember where the administrator was looking at. And one of the people was saying, you told us wherever you are going, you must put on what? Condoms. In other words, that was lack of proper communication. So whenever we are spreading this, talking to people on whichever method we are supposed to use, let us educate them properly. Let us tell them properly the need, because they may not understand. Now, anyway, you know, I was imagining you are the people who are there in those areas. So, having said a few things, allow me to read Her Excellency's speech, because I don't want to take more time. So, distinguished guests, ladies and gentlemen, it is with great pleasure that I join you all today as we commemorate this year's World Contraceptives Day here at Langa Sub-County Hospital in this great city of Nakuru. I want to take this earliest opportunity to thank the organizers of this event, our staff and more partners in the health sector. We are humbled by the work and efforts that you invested in preparing for this event. The theme for this year's World Contraception Day is the power of options in reproductive health, where every pregnancy is wanted. As aptly, the options in contraception are the cornerstones of reproductive health and family planning. They allow people to choose the method that best suits their needs, preferences, and circumstances. Whether it is through pills, condoms, intrauterine devices, injections, implants, or sterilization, these options give individuals a greater control over their lives and futures. The latest results of the Kenya Demographic Health Survey have revealed the prevalence rate of modern contraception to be at 67%. For Nakuru County, the survey showed that the total demand for contraception in this county is 80.4%. It is therefore evident that we have an unmet need for family planning standing at 8.3%. To bridge this gap, we have made investment in training health care providers in our county on provision of both long-term and short-term contraceptive methods. We have also provided equipment and supplies to be used in service delivery points. This has ensured equity among young people, marginalized communities, and women and girls who face discrimination and barriers to accessing health care. Today, we reaffirm our commitment to close these gaps and ensure that everyone, regardless of their circumstances, has access to a wide range of contraceptive choices. We must advocate for comprehensive sex education that empowers individuals with the knowledge they need to make informed decisions about their bodies. We must support healthcare systems that provide affordable and accessible contraceptive services, ensuring that no one is left behind. Indeed, when we invest in contraception, we invest in the health and well-being of families and communities. We reduce infant mortality, improve economic opportunities, and promote gender equality. The power of options extends beyond individual choices. It shapes societies and paves the way for a more equitable and prosperous future. On this World Contraceptives Day, let us remember that the power of options goes beyond the contraceptives themselves. It is about choice, dignity, and empowerment. It is about the right to plan one's family and the opportunity to create a better future for all. It is about ensuring that every pregnancy is wanted, welcomed, and supported. As we continue our work to promote reproductive health and rights, let us work together to break down the barriers that stand in the way of access to contraception for all. Let us advocate for policies and programs that prioritize the power of options and make it a reality for everyone, everywhere. In conclusion, I acknowledge and appreciate the contribution of each one of you, our staff, partners, and the private sector for stepping in to provide a range of options in contraception to women. Thank you for your commitment to this vital cause, and let us march forward together towards a world where every pregnancy is wanted and every person has the power to choose their own path. Thank you.
Ministry of Health is on our toes. The President is really taking us head on, and we're really responding to his call. I want to appreciate the CHPs who are here. And as a nation, we have identified the CHP program as our entry and exit for our achievement of our universal health coverage. And that's why it's a presidential directive. And within few months, we've managed to marshal 100,000, together with the help of the counties, 100,000 CHPs. And yesterday was a celebration because we have managed to achieve delivering the kits. We launched Nairobi County, the 7,400, but it was a launch of the CHP kits that the President has promised. So the 47 counties have their kits dispatched. Yours should have arrived last night. I'm not sure if it is here. And we are going to continue celebrating even in the Mashujaa Day 20th. In the kit are instruments and applications that will help them to ease their work. In the kit, in the skit that they were reading here, they were saying, kitabu imeyuka because of the rain. Imenyeshewa. The book will not be rained on again. There is a BP machine, there is a weighing machine, there is a glucose testing machine, there are tablets, the 6 drugs that you are allowed to use at the community level, the deworming, the aqua tap for clean water, and all those things will be coming. Above all, there is a gadget, a high-tech phone that iPhone, but it's just like an iPhone that information. As you collect, hakuna mambo ya kuandika karatasi na kitabu. You're going with your phone. The phone shows which house you are in. The GPS, you put in the data. It's observed all over the world. So it's called Electronic Community Health Information System, and Kenya is one of the first countries in Africa to really have this agenda. So UHC without CHP is not achievable. Na wako na bottle ya kubeba chai ama maji wakitaka kutembea the whole day in the community. We are asking the community members to receive them. Wako na uniform, wako na badge, and they are recognized. So wakikuja nyumbani, tafadhali fungulia nyumbani, karibisha, give them a cup of tea if you have, give them some water, yeah, because they are there for your own benefit. Sisi wote hapa kuna ugonjwa mingi tunajua watu wanapata. ZAM 2025-26 as a government of Kenya, 100% of commodities will be funded by the GOK. And that is also one of the few countries in the world that has managed to take that up. So leo tunasherekea World Contraception Day na inasherekea dunia mzima. Sisi tulianza 2007 I think. Paka leo kila mwaka tunasherekea. Na nikauliza timu yangu kwa nini mlichagua my home county. Wakaniambia that's the best team we can find. That does not require our presence, that can smoothly mobilize the government plus the population, and they have achieved quite a results. For your information, there is no 100% prevalence rate in family planning. 75 is the maximum, so we are at 72. After that is, you cannot control population. Lazima kuna population watu wanataka watoto, sindio? So 25% we allow them to be the population who want to get the children they want, so that we continue prospering. So we are happy to be here. Other programs are still selecting Nakuru, but we have to be fair. And the other day the DG told me, be fair and be equitable in your resource distribution. So hongera to the team of Nakuru County, the health team. plus the Langalanga team. So now allow me to read the speech of our Cabinet Secretary, who could not be here today due to exigency of duty. Ladies and gentlemen, I want to extend a warm welcome to you all to this event on behalf of the Ministry of Health. The theme of this year's World Contraception Day, the power of options, shines a spotlight on the crucial role that contraceptive choices play in empowering individuals to take control of their reproductive health. Today, it is essential to recognize the significance of providing a range of contraceptive options to individuals, allowing them to make informed decisions that align with their unique circumstances and aspirations. This theme is not only about contraception, it's about fostering autonomy, informed choices, and advancing global efforts towards reproductive health and family planning. On the landscape of contraceptive options, access to a variety of contraceptive methods ensures that people can choose what works, taking into consideration factors such as lifestyle, health conditions or comorbidities, and future plans. Contraceptive methods range from hormonal options like birth control pills, patches, and injectables to barrier methods such as condoms and diaphragms, and long-lasting reversible contraceptives like intrauterine devices and implants. Each method comes with its own set of benefits and potential side effects, and by offering options, individuals can find what suits their preferences and needs. This diversity calls for a comprehensive array of contraceptive methods that cater for the unique requirements of everyone. This approach not only empowers people to plan their families, but also enhance their overall well-being and autonomy. The Ministry of Health recognizes the significance of the comprehensive quality reproductive health services in ensuring safe pregnancies and healthy childbirth. MOH commits to promoting planned pregnancies and contraception services in line with the essence of the power of options theme. Empowerment through informed choice begins with the education. It is essential to provide accurate and comprehensive information about each contraceptive method to empower individuals to make informed decisions. Resources like the National Family Planning Guidelines for Healthcare Providers by MOH are invaluable tools that healthcare providers can use to guide conversations with their patients. Informed choices ensures that individuals can confidently choose a contraceptive method that aligns with their reproductive health goals. The Family Planning 2020 initiative has been a driving force in advancing rights-based family planning and upholding the promises of Cairo. It emphasizes the importance of choice-based approach to family planning, aiming to meet unmet need and promote comprehensive quality reproductive health services. The initiative's reports such as contribution of FP 2020 in advancing rights-based family planning sheds light on progress made and challenges faced in this journey towards empowering individual through informed choices. Birth spacing and task sharing. I wish to highlight the significance of spacing pregnancies for maternal and child health. Adequate spacing can reduce health risks for both mothers and children, contributing to a healthier families and communities. Additionally, task sharing enables healthcare providers at various levels to offer quality family planning services, ensuring that more individuals have access to a wide range of contraceptive options. Further, community health promoters have been equipped to offer quality information and services at the community level. The power of options is more than a theme, it's a call to action. On this year's World Contraception Day, let us celebrate the strides made in empowering individuals to make choices that align with their reproductive health goals. By providing access to a diverse array of contraceptive methods, fostering informed decision-making, and upholding human rights principles, we can collectively contribute to healthier societies, gender equality, and improve quality of life nationally. Ladies and gentlemen, the government of Kenya commits to increase domestic funding for ensure commodity security and enhance access to a wide range of contraceptive options. It is envisaged that these efforts are geared to a zero unmet need for family planning and contribute to a reduction of maternal mortality. In conclusion, I wish to thank the County Government of Nakuru for hosting this year's events, partners and the organizing teams for ensuring a successful 2023 World Contraceptive Day commemoration.
A big thank you to the Ministry of Health for choosing Nakuru County to hold this national celebration for World Contraceptive Day. Wangechagua mahali ingine lakini wakaamua wakuja wapi? Tutasema nini? Very important. Take our regards to the CS. Secondly, this is a big day for us, I would say. But before I continue, I would want to recognize, you'll allow me, the hospital board which runs this facility where we are seated. Tafadhali wasimame. Hao ndio wanajali maslahi yetu hapa Langalanga Hospital. Would have given them a chance, but mutatusamee kwa sababu ya muda. Sitasema mingi, you are not allowed to say a lot when your boss is there. But for me is to first thank our CHPs. Sasa wametoka wanaitwa CHPs. Hebu wasimame niwaone. CHPs oye. CHPs oye. These are our foot soldiers. For all the partners. If we don't hold these people's hands, then the issue of talking about going to the household is not going to be possible. It's a big team. The launch started yesterday, but after that, on 20th, we are going to launch in the counties. Her Excellency, the Governor, Susan Keheka, is going to launch our CHP team on 20th October. From there, the program will start flowing. Na najua hayo mazuri yote tumeambiwa yanaletwa kutoka kwa serikali yatatufikia. Secondly, I would also like to say a big thank you to our partners. You have made a difference in our life. We get commodities from you. We get education. We get training as we go out there preaching this gospel of watu wapange uzazi. Najua tumetoka mbali, especially due to cultural issues where family planning was not allowed. Ulikuwa unaambiwa vile ule pastor alisema, enda mjaze inchi. So feel the world. And it's taken a big step kufunza watu sababu za kupanga uzazi. Na tumeona Nakuru, mmeona tumeitika mwito at 74, 72. We are going on well and we'll continue educating our people so that we remove that cultural thing that ni mbaya. There is a reason why you are told to plan. Remember option ni kufanya nini? Ama what is the slogan today? The power of options. Where you decide nitapanga hivi ndio niweze kusupporta watoto based on what is in my pocket. So we'll continue training the community on the same, and I believe next time when you come here, they are the ones who will be speaking for themselves. What I would really finish with is in terms of awareness. Mesikia the young lady saying she didn't know. Hakuna kitu alijua. Ameshika mimba ajui. Kama iko madawa ajui. Clinic ajui. Ni jukumu yetu sisi wote. Imepita wakati ule zamani tulikuwa tunasema hatuwezi ongelesha watoto wetu. Na siku hizi si mama peke yake anaongea. Hata mzee anafanya nini? Anaongea. Hakuna siri. So let's go outside there. We ambassadors, the way we are seated here. Hata ukienda uongeleshe mtu, hey, leo nilikuwa in such a function and hii ndio masomo nilipata. We provide the services in all our health facilities. Tafadhali visit, ask. Na ukipata vile nimesikia the guy from Gilgil saying, nurse mwenye ni mkali, don't give up. Anakuwa mkali kwa nini? Mwambie niko hapa kwa sababu ya mimi na ni haki yako kuhudumiwa, si ndio? So fight for your space. That's what I would say, fight for your space.
Ninagoja tu kasiku niende nijifungue. So nikapatana na some few friends of mine wenye walikuwa wamepata watoto, wakaniambia niende youth friendly center. Karo ni nani hata juu youth friendly center ni nini? Mimi nikaenda. Nilienda kukaa kwa outpatients. Nagoja kuhudumiwa. Kidogo naambiwa nafaa kuenda kwa kupima HIV. Nilienda VCT. Sijui anything. Ilinichukua siku tatu. Ndio nijue na niende youth friendly center, niongeleshwe na daktari yuko hapo, niende ni access services, niende lab, hizo vitu zote sikuwa na information. So after nimejifungua, nikaambiwa nafaa kurudi kliniki. Mimi nikasema narudi wiki 2 kufanya nini? Kuangaliwa mtoto kitovu. Hiyo ni kitu ya dunia na itai. Mimi nikaenda nyumbani. Nikakaa, naambiwa nafaa niende sijui planning, sijui contraceptive. Napanga uzazi na sijaoleka. Sipangi uzazi. Nikinasikia tu story ya contraceptive. Contraceptive ni nini? Sijui shit. So after some times mtoto akafika 5-6 months, nikapatana na a certain group which inadeal na theater. Ndio kuna introduce kwa certain organization which nilienda training. Mimi ninaenda training na kabat, sijui contraceptive ni nini. Mimi nawacha tu wapige kelele. But as time goes by, nikakuja nikajua kweli tunahitaji these things. My sister ananifuata saizi yako 26 years, mimi sasa niko 25, but my sister akona 6 kids. Me I have only 1. So if kama singepata hii ujuzi ya contraceptive na create awareness about contraceptive, trust you, my sister yangu saizi angekuwa na watoto 10. Ukweli ama uongo? So at least nimemsaidia hata yeye, anaweza kupanga uzazi. Mimi pia at least itaongeza mwingine kwa sai. So, tunajaribu kusema nini? Tujaribu create awareness on family planning. As much as watoto wanapata mimba, wapati mimba kwa sababu wanalalanga waende wapate mimba. Unajua sijui msimind Kenya nitasema, unajua sisi vijana tunapenda ngono. Ukweli ndiye isemwe. Na hakuna venye utaniambia niende ni abstain. Nita abstain aje? Uwezi. So sahi hata underage mtoto class 8 sahi hata niende nimsimamishe nimwambie ashko. Si unajua abstain. Sasa abstain aje? Hawezi. Ni nini wanafaa kupata? Information. Unajua hata saizi nikichukua mtu nimpeleke kwa youth friendly center ataenda ongeleshwe. But atasema daktari hataenda kuambia mama yangu. So if young people wanaweza kuwa trained on how to create awareness kwa watu wengine, unajua kijana anatakanga ongeleshwe na njia zote. Kama ni sheng yenye anaelewa, usiende kumuongelesha na kizungu, atakuangalia. Hapa inatokea hapa. Naona. So na platform inajiita Life Yangu. Life Yangu ni a platform inaweza kukudirect kwa near facility yenye unaweza pata all services, kila kitu kenye unahitaji. Tuzidi create awareness on family planning ndio vijana wasizidi kuzaa. Another thing, tusiseme tu kupanga uzazi. Pia sasa kuna HIV. Vitu ngapi? Mambo ni matatu. Jijue, jicondomize na ujiprep. Bure, tutakuanika kama jua. Kwa jua, tukikurudisha ndani. Asanteni.
Before we apply family planning, lazima uko na that information. Karomes because he didn't have the information. I feel good because mimi nilintroduce Karo kwa youth group. Saizi nikimwona kiongozi naona kama kuna kitu nilisaidia kwa society. The first thing niko na notes tu kidogo. Access to contraceptive method. This to ensure that individual and couples have easy way to access contraceptive, e.g. condom, control birth pills and injection, hizo zote, sindio? All the contraceptive method. Then the second one, awareness. Mostly Kenya Kara lack awareness because hakukuwa na that information that Karo missed, because that information hakukuwa nayo. But if you had that information, hangepata mtoi, sindio? But hatuwezi blame. Saizi hapo in a position anaweza saidia dem fulani mwenye ajui. The second thing, affordability and availability. We do have shortage, because sometimes we have shortage of contraceptive kwa hosi. Hizi pills, commodities. Kuna saa zingine unaweza enda hosi uambiwa kuna. Haya, let's use example kama vasectomy ya men, sindio? Vasectomy ijakuwa watu wajeiongelea paka waka accept vizuri kwa society. Baadhi unasikia hata hao walikuwa na act hapa wakatumia that word, watu wakacheka. So what can we do ndo watu accept the vasectomy is part of family planning ya males, ndio? Hai, the last one. Tuko na healthcare provider training. As much we have provider trainings, they should be trained to provide contraceptive counseling and services. Kuna sometimes unaweza enda OC, sijasema ati wenye wako hapa, unaweza enda OC upatane na nurse is not friendly. If nurse is not friendly, uta feel comfortable kwa place huko, si ndio? Then if nurse is judgmental, will you be wezi kuwa hapo, si ndio? Then the second thing, privacy, confidentially. Kama wewe ndio unaenda ku apply this contraceptive, ama unaenda ku apply any method that you want, alafu then later story inafika kwa mzazi ati niliona kijana wako huku kwangu alikuwa anatafuta nini 1 2 3, mzazi ameweka na mkutano because ulienda usiku apply something like that, si ndio? So hata wazazi acha tuweke usiku kando. Hebu kumbuka the last time mzazi yako alikiweka chini mkaongelea about contraceptive ama condom. Kwa society zetu tunaona kama ni taboo, but it's not a taboo. Ni kitu intakana to embrace, to accept, ndio?